Hello, you're watching this DVD because either you or someone you care about is suffering with a digestive disorder. Could be IBS, which is irritable bowel syndrome, IBD, which is irritable bowel disease, like Crohn's, ulcerative colitis, diverticulitis, just to name a few problems that people have when they have a digestive issue. And when you have these problems, sometimes it's a functional problem like IBS, where you have an irritable bowel problem, you have testing done, and it all comes back normal, but you still have all these symptoms. That's really a functional problem. Or there's actual disease process going on, like in IBD, which would be ulcerative colitis or Crohn's or diverticulitis, or some damage that's occurred. And with that damage comes along digestive problems like constipation, diarrhea, cramping, abdominal pain, passing mucus, fistulas, sometimes even skin rashes, joint pain, because there's also an autoimmune component. Like with ulcerative colitis, it's really an autoimmune condition, which means your immune system is attacking your digestive system, your GI system. And maybe you've gone to the internet and you looked at trying to find answers besides drugs, because drugs will sometimes help with some of the symptoms. But the problem with just taking drugs is that all it does is it treats the symptoms. It doesn't look at or correct the cause. And that's what we're about. We're about correcting causes. We never tell people to stop taking medications, but we also realize that a lot of times these ongoing problems are because the causes have not been addressed, and that's what we do. And maybe your problem is this condition is dictating your life, your day. I've had patients tell me that they have to plan their day around their digestive issue. I had one woman tell me that she would not eat all day if she planned on going out in the evening. So as you know, this can really start to become an issue of quality of life. And I'm here to tell you that there's hope and there are real answers. What we do is we look at you as an individual. We can have 10 people that have all been diagnosed with the same problem, but they all have a different reason why they're having that problem. And we look at you and we say, okay, what's going on? This person is probably suffering from what we call a web of physiological dysfunction, which means it's a layered problem. So we're going to look at blood work. We're going to do some testing that you haven't had done. And you may feel like, oh my gosh, you've had a lot of testing. We do testing that hasn't even been considered. So we start with blood work. We do a comprehensive panel. And then we might move on to a stool test, where we're looking for parasites and yeast and bacteria. We want to see if your bacteria count is either where it is. Is it good? Is it bad? Is it low? What's going on? Do you have viruses, bacteria, fungus overgrowth, yeast overgrowth? You may be reacting to foods. Maybe you've eliminated gluten from your diet and you're still having problems and you can't figure out why. Well, in gluten, when you go for the gluten-free products, a lot of times it's still processed food, and there are things that they use in replacement of wheat in these gluten-free products that you could be reacting to. You may be reacting to some of the something called cross-reactive foods that aren't necessarily what we would consider bad foods, but you may be reacting to them, like coffee and rice and potato, milk chocolate, things like that that you could be reacting to, but you just don't know. You may also have what's called leaky gut. Now, in your intestines, there's a barrier system. When you have leaky gut, there's a breakdown in that barrier. And so things that get into your bloodstream that shouldn't get in there, like food particles and bacteria, viruses, that now can get into your bloodstream. And when that happens, it causes an immune response. Your immune system responds to that, and you start have a flare-up, and you can't figure out why. Well, it's very possible you have leaky gut. So we look at all these different things. And we look at the testing that hasn't even been considered. Then we evaluate the results of that testing. And then we help you determine what you need to do to get your health back on track. What we provide are tools, a system, and support to walk a person through the process of regaining their health. So you never feel like you're on your own trying to figure this out, trying to understand the test results. We are there for you to walk through that process. Now, I have a real special place in my heart for these types of problems because I have a younger brother who's 47 years old, and he has Down syndrome. And my brother Chris had a severe digestive problem for 3 years. And they did the upper and lower GI. They did all kinds of testing on him, could find nothing wrong, and he continued to suffer. And my brother had horrible diarrhea to where we never knew when he was going to have a problem, and it was really a big ordeal. Well, we finally did the testing on him, found that he had some parasites, he had low bacteria, We got him straightened out with his diet, gave him the supplementation that he needed to heal his system. So we give you supplementation, but it's not supplementation that's just, you grab it and hope it works. It's based on your lab test results, and that's what we did for Chris. Since we've started that, he's had absolutely no problems, which is a huge, huge change in his quality of life. And of course, for everyone, his family, our family, and everyone around him, that's not an issue any longer. So I have a real place in my heart for these types of problems because I know how much impacts quality of life. So if you're interested in a consultation, call my office, 231-882-5533, and we will schedule you from there, give you the details of the appointment. And if you just want more information, just feel free to opt in and we'll give us our email address and we'll send that information to you. I look forward to adding value to your life. I'm Dr. Janine Johnson.